Hello and welcome to our show Health and Wellness, Myths versus Facts. I'm Gargi Rawat. The endocrine system regulates the release of hormones into the bloodstream, and these hormones are important for many bodily processes such as reproduction, metabolism and growth. Diabetes is one of the most common endocrine disorders, and it occurs when your pancreas cannot produce enough insulin. Therefore, your body cannot use it properly. And today the number of people with diabetes is higher than ever before. And it's not just your grandparents you need to worry about. People are getting diabetes earlier and more often. But though there is no cure for diabetes, there are things you can do to manage it and its health complications. Education is one of the most important components to ensure better management and control of diabetes. In this program, our experts provide medically accurate and actionable advice on preventing diabetes and help viewers identify strategies for long-term control. Today we're joined by Dr. Abhilash Nair, Assistant Professor, Endocrinology Department, Government Medical College, Trivandrum, Dr. Soumya S., Consultant Endocrinologist, Indian Institute of Diabetes, Trivandrum, and Dr. Vaishali S. Naik, Consultant Endocrinologist, Diabetes and Endocrine Center, Lilavati Hospital and Research Center. Thank you so much, doctors, for joining us, on the program and to talk to viewers and, create awareness around diabetes. Dr. Nair, I'd like to start with you. Type 2 diabetes used to be known as adult onset diabetes. Now it's becoming more common in young adults. What's the reason for this?
Yeah, Gargi, that's a very good question. The thing is that we know India is already called the diabetes capital of the world, and 1 out of 4 Keralites are known to have, in adults, are known to have diabetes. But now the problem is that the disease is invading the younger generations also. And in one of our surveys, we found recently that 1 in 200 persons between 18 and 30 years of age are having diabetes, and another 1 in 40 are having pre-diabetes. So why is this happening is also came forward from the survey that 35% of these of our younger generation has a family history of diabetes. That is, there is a high genetic risk of diabetes in the South Asians or Indians. And apart from that, 94% of these young adults were not having any exercise, or they are having a sedentary lifestyle. And due to that, around 45% of this young adult population is overweight or obese. So apart from the genetic risk, we have the burden of lack of exercise and overweight and obesity, which is driving this pandemic to the younger generations.
All right, Dr. Soumya, pregnancy is a very crucial phase in a woman's life. So it's understandable that a woman may get scared and worried when she discovers she has gestational diabetes. Is it a serious condition, and how can it be better managed?
Yes, diabetes in pregnancy is an important condition. If not treated well, it can lead to complications both for the baby as well as the mother. The baby can develop large birth weight, birth injuries. They can lead to low blood glucose levels and jaundice in the newborn period. And the mother can experience high blood pressures, bleeding into the placenta, infections, and even sudden death of the fetus in late pregnancy. And both the baby as well as the mother are at increased risk of developing complications, metabolic complications later in life, like diabetes, heart disease, hypertension, stroke, etc. So, but nothing to be scared about. If treated well, they can have an uneventful pregnancy. And the main strategy for treatment is a lifestyle modification, a dietary modification without compromising the essential nutrients required for the pregnant mother, and being physically active. This is the most important strategy, and it would be sufficient for many women to control their blood sugars. And insulin is the main treatment for high uncontrolled blood glucose in pregnancy. Other oral medications used for treatment of diabetes are not recommended to be used in pregnancy as first-line treatment.
All right, so these are things to keep in mind. And Dr. Naik, can a woman with pre-existing diabetes plan for pregnancy? Also, what steps can be taken to ensure that it's a safe and healthy pregnancy? And is a woman with diabetes more prone to then develop gestational diabetes?
Yes, so a woman with pre-existing diabetes can definitely plan a pregnancy. it's important to stress to all the women who are diabetic and in the reproductive age group that their blood sugar should be well controlled right from the preconception stage. So once their blood sugars are controlled in the preconception, they can have an easier entry into the pregnancy time. So what we usually counsel these patients is to control their sugars to near normal levels, so with an HbA1c of around 6 to 7%. And many a times the type 2 diabetes or type 1 diabetes who are planning for pregnancy may be having diabetes for a long duration, so they should also screen for other chronic complications like nephropathy and retinopathy, and this should be done right at the preconception level. And also they should continue reassessing for these complications during all the 3 trimesters of pregnancy. So it's important to monitor their blood sugar levels also on a routine basis even prior to pregnancy. Secondly, it's not only the blood sugars, it is also the blood pressure, the lipids which play an important part. And as Dr. Soumya said, lifestyle modification, metformin, insulin, and regular monitoring of blood sugars will go a long way in having a good control of this, and then it will help to have a safer and easier pregnancy for not only the mother but also the fetus and the baby.
All right, Dr. Nair, how accurate is home monitoring for blood glucose? It's all about, managing your diabetes. So is there any need to do the HbA1c test if a person is monitoring blood glucose regularly at home?
Yeah, so the question is about two tests which we are using to monitor blood glucose levels. So home monitoring of blood glucose or self-monitoring of blood glucose, as we say in medical parlance, is checking the blood glucose levels using glucometer at home once in a while, just to know what is the blood sugar level, even when the patient is not visiting the doctor. Basically, it's both have their own places in the management of diabetes, and the self-monitoring of blood glucose is important in detecting high excursions of blood glucose and occasional low values or hypoglycemias, as we call, are also importantly picked up by this self-monitoring of blood glucose. As an HbA1c will not be able to reflect that how many times the patient had a hypoglycemia over the last 1 or 2 months. But HbA1c has its own importance, that it has been studied to have and known to have a very good correlation with the development of complications of diabetes over the long term. So a person who maintains an HbA1c level of 10 is more likely to have a complication early in the course of diabetes, whereas a person who has an HbA1c of 7 or below is almost not likely to go into any complications in the near future. Especially HbA1c is important in the initial part of initial phase of diabetes management, or at the time when diabetes has been detected. If you can maintain a good HbA1c level, you can expect that you can go a complication-free life, or a life just like a person who is not diabetic. So HbA1c is a marker of the control over the last 3 months, and it has its own importance in making clinical decisions, and it can predict the macro and microvascular complications over the long term.
All right. Now, for women, Dr. Soumya, menopause, does it increase the risk of diabetes? And if so, is there a way to then prevent this risk?
Yes, female hormones play a protective role from developing diabetes. So at menopause, there is a drastic reduction of the blood levels of female hormones. So menopause is a time when there is an increased risk of developing diabetes, especially for those women who have certain risk factors, like a family history of diabetes in parents or siblings, or a history of diabetes in pregnancy, or a history of polycystic ovarian disease or infertility, or for women those who are obese or overweight. So to prevent this risk, women should prepare themselves physically and mentally for a healthy menopause right from their early 40s itself. And the strategies include weight reduction by dietary modification and regular physical exercise, and also stress management by relaxation techniques These would be helpful for a healthy menopause. And also, women more than 35 years of age should periodically monitor their blood glucose values for detection of diabetes at least every 3 years, and especially at menopause, to diagnose diabetes early and manage effectively.
Now, Dr. Naik, diabetes affects almost every body part. Do these complications start showing their effect immediately after getting detected with diabetes, or do these complications then take time in showing up?
So, when a person has diabetes, there are two main types of complications. One is the acute complications, which we see at any time of the disease, that is acute hypoglycemia or hypoglycemia. But what we are really saying here is about the chronic complications. So, it is known that the duration of the diabetes as well as the control of hyperglycemia will predict whether the patient will get any chronic complication. Now, chronic complications can be due to a microvascular disease like the retinopathy or the nephropathy or the neuropathy, or a macrovascular disease in which the heart is affected or the brain is affected. So, the patients present with an MI, that is a myocardial infarction or a stroke, or they have repeated diabetic foot infections due to peripheral vascular disease. So these are the complications which we have to detect before they really trouble the patient. So what we usually do is, in type 1 patients, after the onset of their type 1 diabetes, we try and screen for these complications after around 5 years of the onset of diabetes. But what happens in type 2 diabetes patients, the natural history of the disease is that they have pre-diabetes prior to when they present to us, and many a times the patients do not have any symptoms, so they do not check their blood sugar levels and they are not knowing that they have diabetes. So when they present to us, they may be having diabetes which may be pre-diabetes or borderline diabetes, but they do not know it, so it can affect the other parts of the body and present with complications. So in type 2 diabetes, we usually tell the patients to really screen for these complications at the outset and then every year. And even in type 1, we do that every year.
All right. Now, Dr. Nair, diabetes is associated with both microvascular and macrovascular diseases affecting several organs, including muscle, skin, heart, brain, and kidney. What is meant by this microvascular and macrovascular complications?
Yeah, as Dr. Naik was telling, most of the patients do not present with symptoms of diabetes. Most of them, or at least 80% of the patients, are asymptomatic at the time of diagnosis of diabetes. And so most of the people think, why should we treat diabetes at all? Basically, the problem is that diabetes which has taken onset today is not going to cause a problem today or tomorrow. It will be affecting your body or many organs of your body maybe 5 years or 10 years down the line. And that is the reason why we are trying to treat diabetes and keep the blood sugar levels exactly in the range which is safe. So what happens if you are not controlling diabetes properly is that you will land up in certain complications or some other diseases. So what are these diseases? These are basically, diabetes affects the blood vessels of our body, and the organs which are affected through the damage to smaller blood vessels are the kidney, the retina, and the peripheral nerves. So basically these are called the microvascular complications, and the microvascular complications are actually, when it affects the kidney, we call it nephropathy, the retina, retinopathy, and the nerves, neuropathy. And similarly, diabetes can also lead to problems like heart attack, stroke, and diabetic foot, which is a dreaded complication. So basically, these are through the affection of the larger blood vessels or the macrovasculature. So they are called the macrovascular diseases, and basically the heart attack, stroke, and or decreased blood flow to the lower limbs or the foot is called peripheral arterial disease. These are the macrovascular complications.
All right. Well, with that, we'll slip into a short break, but don't go anywhere. We'll be back with more questions for our doctors about diabetes. Welcome back. We're talking about diabetes and steps one can take to manage diabetes, which is a growing problem in India. Let's go across to our doctors now. And Dr. Soumya, what is the treatment approach for newly detected type 2 diabetes patients? Are there any specific guidelines for it?
Yes, there are evidence-based guidelines for management of diabetes. The cornerstone of management of diabetes is a lifestyle modification with metformin. The lifestyle modification includes a dietary modification, cutting down the carbohydrates and mindful eating. And the physical activity includes 30 minutes of brisk walking at least daily. That would help a lot in controlling the diabetes. There are oral medications as well as injectables. To choose which one among these would suit best for a patient, the certain patient factors are considered for that, like age, presence of other comorbid conditions like heart disease, kidney disease, risk of hypoglycemia, weight of the patient, and more importantly, the cost and affordability of the patient. All these factors are considered before choosing what treatment suits best for a particular patient, and more importantly, the present blood glucose levels also. And the monitoring of blood glucose is also very important to titrate the treatment. So there is a stepwise approach to titrate up or down the treatment according to the blood glucose levels of the patient. And the target is to achieve a blood glucose level to prevent the development of long-term complications, which we were discussing earlier.
Dr. Naik, the traditional way to monitor blood glucose levels is with a fingertip prick blood test. People with uncontrolled diabetes may need to have multiple tests in a day. Can CGMS be a good alternative to this?
Yes, so self-monitoring of blood glucose is a mainstay of achieving a good control. So as we know, to start with, we had urine sticks, this was followed with blood sticks, and we have this glucometer with a finger prick check that has been there for last 2, 3, 4 decades, and that really helps to monitor the patient's blood sugar levels. Now the new thing in market is the CGMS, that is the continuous glucose monitoring devices, and these help in monitoring the blood sugar levels almost every 15 minutes. So what are these devices? These are two types of devices. One is the continuous monitoring, which is used when patients are on insulin pumps. Okay, they have been there in market for a long time, but the newer ones are now available to patients who are not on insulin pumps but want to monitor their sugars more frequently. So this can be done with the intermittent CGMS, and for this there is a patch which is attached to the patient's skin on the arm, and they have a scanner with which they can scan the blood sugar levels almost every 15 minutes. So we can have a wide range of tests throughout the day, and the patient can decide what food, how the food, the exercise, the stress levels or insulin doses are affecting their blood sugar levels, and they can adjust their insulin levels also according to the test that they get on these CGMS devices. Now what happens with the finger prick method is many of the patients, they are not willing to do because it's really painful, even though the pricks are now available with better, the needles. But now CGMS has come and patients can use CGMS. It's a painless device. Yes, it is little costly, but it is very useful in patients who are on multiple insulin dosages or who are getting repeated hypoglycemias, or like I said earlier, those who are going to be trying to get pregnant or are pregnant and need a better control or better monitoring of sugars. Also in patients who had done a major surgery and who require a frequent monitoring for a better control of sugars, then CGMS really helps them. And what's important is because it is penless and you can do it multiple times, people are aware of it and they are willing to do it. Also, it tells us the variability about the blood sugars throughout the day. So at the end of 14 days, the patch can be removed. The physician can assess the levels for the last 14 days and they can help in adjusting the doses of insulin or the food intake of the patient or the medication that is used for diabetes, and does help in a better control without really straining the patient much. But one has to remember that yes, it comes with a cost for sure.
All right. Now, Dr. Nair, are complications of all types of diabetes the same, or is there any variation in the severity of the complications?
Yeah, it's important to know that there are multiple types of diabetes. All diabetes are not the same. Most often, what we see in adults is the type 2 diabetes, which where you have obesity, family history, etc., contributing. And the one seen in children, the lean or in the young lean adult also, sometimes it may be type 1 diabetes. And then there are some other types of diabetes, including gestational diabetes is one. Then you have other causes of diabetes like pancreatic diabetes, diabetes caused due to other endocrine conditions, certain drugs and chemical induced diabetes are there. So all of these diabetes are basically different in their causation. And because of that, the amount of insulin they have in their blood, the amount of glucagon they have in their blood, etc., varies. So basically, the complication profile is also different. And type 1 diabetes patients are more likely to have microvascular complications because they have a more difficult to control diabetes than type 2 diabetes. And the patients with type 2 diabetes, as Dr. Naik was telling, may have complications of diabetes even at the onset or at the time of detection of diabetes. So, and another thing is that the macrovascular complications are more frequently seen with type 2 diabetes, probably because of the age at which they are diagnosed and multiple other factors which accompany type 2 diabetes like hypertension, dyslipidemia, etc. Now, the other types of diabetes like pancreatic diabetes have a predilection for hypoglycemia, early involvement of peripheral nerves, etc. And certain other causes of diabetes like secondary diabetes may have complications which are not directly caused by diabetes, whereas the primary disease like Cushing syndrome, acromegaly, etc., they may contribute to the complications of diabetes, which more than what are caused by the micro and macrovascular damage due to the high blood sugar levels.
All right, and Dr. Soumya, finally, diabetic neuropathy is a very serious complication of diabetes. Around 60 to 70% of people with diabetes have some form of neuropathy or nerve damage. Can this be reversed?
Oh, yes. Diabetic neuropathy is the damage caused to the nerves because of the multiple metabolic derangements that occur in diabetes. So it is a slow and progressive process affecting more and more nerve fibers. So once the damage has occurred, it cannot be reversed. So we can only prevent or slow down the progression of the process by achieving and maintaining a good glycemic control. And also importantly, we should monitor for and treat other comorbidities which can be associated with diabetes and which can add on to the progression of neuropathy, like alcoholism, hypothyroidism, vitamin B12 deficiency, high blood pressures and high cholesterol levels. So management of those would help in preventing progression.
All right. Well, thank you so much, doctors, for talking to us and answering all those questions about diabetes and creating more awareness about it. Thank you all for watching at home. Goodbye.